we're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Anne Herleth, VP of Member Insights at the Health Management Academy, and your Nurse Executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. Welcome back to our 3-part series on understanding the perspective of the frontline nurse. This is part 3. And in the first 2 segments, I discussed 2 important topics. First, I talked about the frontline nurse and AI, specifically dispelling the myth that nurses are universally opposed to AI in healthcare. If you haven't listened, I encourage you to do so, and I will link to that episode in the show notes. For part 2 then, I was joined by Nursing Catalyst's Director of Research, Lauren Ruers, to dive into the topic of safe staffing and mandated ratios, including how frontline nurses define safe staffing, what they view as the best options to improve staffing, and their opinions of how their own organization is doing when it comes to staffing. Our big takeaway from the first 2 episodes: the front line needs more information about emerging innovation. Because when armed with data and outcomes, nurses are much more open to new technology, workflows, and other solutions that have the potential to revolutionize how nursing work gets done. And so, in part 3, I want to talk about where nurses currently look for trusted information, where they turn when they need to know more about the nursing profession, technology, healthcare, and other relevant news. And I'm talking about both within and outside their organization. The goal is to not only understand the frontline, but help address the growing disconnect between healthcare leadership and frontline nurse communication. We'll look at hard data that tells us exactly where leaders are missing the mark, particularly around emerging solutions and care transformation. And we'll talk about how to fix it. Because as we learned in part 1, nurses do not feel like they know the strategic direction of their organization, and as we'll discuss today, don't have a ton of innate trust in their own organization. Before we jump in, a quick note on the data I'm going to share today. My team, Nursing Catalyst, conducted research across the summer of 2024. The research includes data from a survey of over 400 acute care nurses, as well as insights from our message testing and focus groups with frontline nurses and frontline nurse managers. In both the survey and focus groups, we ask nurses directly about where they get their healthcare and nursing information and who they trust. And here's what we found. To start, let's break down exactly where nurses are getting their nursing news and updates today. Overwhelmingly, nurses look to professional organizations like the ANA and AACN for relevant information. At 74% of nurses, this was by far the most common source of information. And by the way, for managers, the list also included AONL in addition to the ANA and AACN. When we dug into why, it all comes down to trust. For many, the association relationship starts in nursing school, and then over the years, the association is seen as an advocate for the nurse, not the organization in which they work for, which naturally builds trust among its members. That relationship only strengthens with time. So the bottom line here is what nursing associations say, publish, and support hold a lot of weight. And for 3 out of 4 nurses, the association is the place that they turn for trusted professional information. After that, nurses primarily look internally to their own organization. Almost 60% rely on information from colleagues and peers. And the peer influence in particular tends to spike during periods of change or stress, which I think we can all understand why. Unfortunately, leadership, which I would say is a natural source of information, isn't as high on the list. Less than half of nurses, really only about 42%, look to their direct manager for information. I will add, though, this varies by tenure. And with our most novice nurses, manager influence jumps to about 63% and then steadily declines over time. Executives or the least common type of leader to be seen as a source of trusted information, with just over a quarter of nurses citing that their chief nursing executive was a primary source of information for them. Now, if you listen to part 1 and 2 of this series, these results probably don't shock you. More and more, nurses are looking to their peers and outside their organization to help contextualize the challenges that they are feeling day in and day out. And I think these data really just further support that finding. But here's something that might surprise you. Despite all the buzz about nurses on TikTok and other social media actually ranked second to last in terms of an information source, and only 27% of nurses cited it as a primary source of nursing news and updates. I mean, that is a full quarter, but it is not even close to the majority. But what is even more interesting when you look at the social media group is that the least likely group to use social media for professional information is novice nurses. This completely contradicts the common assumption that younger nurses are driving social media engagement. Remember, novice nurses are looking to their associations, and then they're looking to their manager, which underscores yet another reason that good unit leadership is critical. One other note worth calling out here is the union factor. Among nurses working in a unionized environment, 65% cite that the union is a primary source of information. And this really indicates that unions have a far stronger presence than executive leadership among the frontline when in a unionized environment. In non-unionized environments, I think it's probably pretty easy to understand that unions are not seen as a primary source of information or really hold a lot of trust among the frontline. So why does any of this matter? Here's my take. If health systems want to move forward with innovation and care transformation, they need an engaged frontline who will not only adopt new workflows, but are bought into the vision of how work will get done. And right now, health system communication strategy is generally failing to accomplish this. Not because executives aren't trying, but because they're not approaching it in the right way. From all the data and focus groups that we ran, there was a clear theme. There is a massive canyon between what executives think they are saying to the front line and what nurses are actually hearing. This means nurses approach every organizational announcement with deep skepticism. Even positive changes, like reducing documentation burden, are met with raised eyebrows. As one frontline nurse put it bluntly, "It feels like the hospital is trying to get around telling me that we're understaffed. I know we are, and they just won't say it." But here's the good news. We can, in fact, change this. In part 1, I talked about how sharing the right kind of information with the frontline can change their perspectives. But nurses don't just want information, they want the right information contextualized to their day-to-day experiences. They want to know how the changes will impact their patients, their workload, and their ability to feel like they've delivered safe, high-quality care. But nurses also want authentic, transparent communication delivered by people they know, and that really starts with managers. So here's my advice for solving that communication canyon. First, we have got to equip managers to deliver clear messages on staffing, innovation, and other changes. This really means 2 things: giving them dedicated talking points, and when communicating about new technologies or models of care, make sure those talking points include concrete examples and real-world impact. Show, don't tell. And then second, make sure your managers are true staffing champions who can translate leadership vision into frontline reality. This means managers need to be on board with the decisions that are being made. They are not another point in your communication plan. They are the most important group to engage and empower in the decision making. And then, once you equip your managers, site-level CNOs need to provide backup by being visible. 61% of nurses want to hear directly from their chief nursing officer more often. But the catch is only if those CNOs are visible on the unit. In fact, in our focus groups, there was a clear divide between those who self-reported a highly visible executive team and those who said they never see their CNO. Visibility, more than talking points, is what matters at the executive level. So 2 key steps to help bridge the communication gap internally: really elevating that manager and making sure CNOs are backing them up. Now, before I wrap, I want to come back to the power of the association. As health system leaders, there is an opportunity to leverage associations to share more positive emerging stories of innovations, pilots, and other trends that will impact the frontline. One of the biggest communication challenges I see right now is that the frontline is simply in the dark about so many of the emerging solutions that can and will transform patient care. Sharing those success stories more often is key, and leveraging associations, who are the most trusted voice to the frontline, is a powerful way to do that. The future of healthcare doesn't just depend on technology. It depends on trust, on communication, on truly hearing the people at the front lines. To every chief nursing executive listening, your nurses want to believe your vision. They want to be part of the solution, but first you've got to meet them where they are. So I hope that you feel like today's episode helps you understand the perspectives of the frontline a little bit more. Thank you for joining me for this 3-part series on frontline nurse perspectives. If you have thoughts, please reach out. I want to hear them. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.